July, I was getting some epidural injections for that, some steroid injection. It seemed like it worked for about taking care of my neck discomfort.
And it would be neck pain that caused you to get the cervical epidurals?
And because when I would start feeling tingling to my first 3 fingers on my left side, it was mostly left side.
Your thumb and your pointer and your middle finger?
Mm-hmm.
Okay.
Yeah,
on the left?
Mm-hmm.
Okay.
And I always had some restricted range of motion, and mostly to the left, but it was the chronic low discomfort was easy to handle, and especially when I was skiing or hiking a lot with poles and keeping it loose, it sort of kept it under control, and I had minimal change. But like I said, after about 12 months, I would start to feel tingling again, and I would get the injection, and the tingling would go away. And I still had a little low-grade discomfort, maybe in the 1 zone, but hardly anything that bothered me. And some days I wouldn't even know about it. So that was the only thing I had prior to that.
Yeah.
I had minor lower back discomfort prior to that as well. But again, it was mostly after I ski a lot of bumps, and I ski a lot of hard terrain. So it'd be after a day when I really pushed myself, and I pushed myself a lot.
But routine, day-to-day, no back problems of any kind?
No.
All right, so now fast forward to you wake up, you get up and you've been pretzeled by the tree. What hurt, what didn't hurt?
So when I first got up, my neck hurt a little bit, my lower back hurt a little bit, and my right leg hurt, especially my butt and my hamstrings. So I hiked out and I felt my legs quivering a little bit, but my right leg was more painful and my left leg was just sort of quivering. So I didn't know what happened, so I just sort of walked it off, and then I went home and I told my wife, Diane, who's a physical therapist, who doesn't take me as a patient, but does physical therapy on me at home.
Yeah.
And basically, the next day she evaluated me, and I was pretty level. My pelvis always goes off a little bit. My right side usually goes up a little. So she worked on that, and I had hamstring, especially proximal hamstring pain. So we thought maybe I tore pulled my hamstring. Maybe going up like that, it might have done that.
Yeah.
My right abductor.
Left or right?
Right.
Okay.
My right abductor was mildly painful, and my hip flexor hurt, but I have really tight hip flexors, and they're always an issue because I don't stretch enough.
But the neck was not bothering you?
The neck was just bothering me a little bit, but it was sort of like, oh man, it hurts. It's probably going to need another injection type of thing. But I wasn't getting tingling at that time or anything like that. It just felt like I had a bad fall, and it would work it out.
Okay.
So it was COVID, and I couldn't see anybody because everyone was closed. So I said, well, Diane worked on me a couple times a week for about 4 weeks, and I was not really getting any improvement. If anything else, I was starting to feel more leg pain, especially on the right side. But the left side was starting to feel a little affected. And my feet were feeling really weird. I could never explain it to everybody because they just sort of felt like they were heavy and swollen, but they weren't. They didn't get tingling or anything, but they just didn't feel right. And I still continued to walk a lot. Ski season was over, so I put my skis away anyways because everything closed down. So I was walking a lot, and I just wasn't getting the endurance that I thought I should have. And at the same time, Diane was noticing that I was breathing harder when I was trying to do anything uphill and that was more strenuous than just walking. So even when I did a lot of activity, I felt my legs were starting to really hurt. My muscles hurt a lot, and my breathing was worse. I was getting hoarse for some reason. I'd have a cough if if we do a really long walk or hike. And my legs, I could feel my leg, when I would be doing something that I normally don't have any exertion issues, I'd have to talk to my legs, come on, keep moving, get going, feel stronger, and they weren't feeling like my legs. So
Were they different, or was the effect of the legs being weak and feeling kind of weirdly swollen, was it both legs the same, or was one worse than the other?
The right was always worse than the left, but the left started to become more affected.
Okay.
And as far as strength versus weakness, my left leg is always my weaker leg.
Yeah.
So when it started getting a little weaker, it was just weaker.
Yeah.
Because it's all on all my muscle
normal
tests, and when I ski, my left leg's always my come on leg. It's my weak.
And you're
side.
right-handed.
I'm right-handed.
Okay.
Yeah, I'm definitely right dominant.
Yeah. Okay. And so we're now several weeks out since the accident. Was there pain in the neck?
There was a little bit of pain in the neck.
But not much.
Not much more than normal.
Yeah.
There was, whenever I get my neck thing, I always get, it comes down here.
Yeah.
That's where I get my discomfort, where I
Right.
have now. It's always a little uncomfortable there. So, because when I first started doing the neck thing, we thought maybe a rib was out, because in the past that's where it's pretty much been, but it was always exacerbated by my neck pain.
Yeah.
And I started getting a little bit lower back pain, more than normal on my right side, which is always, if I'm going to have a little back pain, it's always more on my right side, and that's where I always go up more. So Diane started working on that as well when she was working on my hamstring. But it didn't show improvement. If anything else, it got a little bit worse.
Okay. What happened next?
Next, we made an appointment, and we finally got into the back specialist, and I ended up. I live in an area where we have either University of Vermont Medical Center, or a lot of us people go to Dartmouth, because Dartmouth gets you in faster. And it's a longer drive, half hour versus 2 hours, but you can get in earlier. So
2 hours saves you 2 weeks, right?
Exactly, or a month.
A month.
Well,
yeah.
they were so backlogged because of COVID.
Yeah, I'm sure it was a screwball situation.
Yeah. So my primary doctor, what they told us was, we're going to get you into Dartmouth because you get in quicker.
Right.
So I went to the pain and spine people at Dartmouth, and he hadn't seen me at all. The guy who I used to do my back stuff, my neck, left town, so I was stuck where I didn't have anyone.
Yeah.
So I wanted to go there for a cervical injection because my neck was starting to bother me more. Now, after 3 or 4 weeks, it actually started to bother me more. So we didn't know if maybe my neck stuff was causing what I was doing or what. So I went for 2 reasons. I went to talk about my neck because I wanted another epidural. It was about time for what I usually do anyways.
Yes.
And I wanted to discuss what was happening to the rest of my body because it wasn't behaving itself. So he then ordered MRI because I hadn't had one for 5 years, and before they did anything, he wanted to see if there was any change.
Is that the MRI that I have?
You have all the MRIs. You have the one of 5 years ago, 6 years ago, and then you have the one the more recent one that they did of the cervical spine. That was the first one they did. The disc was supposed to send you everything that they had on file.
Okay.
So
what happened then?
So then after they saw that, he set me up for an epidural. I had the epidural. It worked okay. It didn't work as well as it had in the past, but it got rid of my tingling that had come back again. And it worked okay, but it just was never as good. But it was satisfactory, but it wasn't as good as I'd had in the past. And then I went back to him, and then I said, okay, now we'll try to work on what's going on with the rest of you. And that's when he sent me for an MRI of my lumbar spine. And that's where they saw the stenosis at 3-4, 4-5. He thought that a lot of my signs were more L5-S1. So he said, we're going to do an injection, not for diagnostic, and as well, maybe therapeutic.
Right.
And I got absolutely no response from that.
Nothing.
Didn't change
Not even
anything.
a few hours. Zero.
Not even
zilch.
local. Nothing.
Okay.
So when I came back in and he heard that, and at the same time, all my exams, I showed that I'm just as strong.
Did he inject the left or the right or the middle?
He injected the right.
The right. And there was pain to relieve. It just never went away.
That's correct.
Got it. Okay.
He went to the right.
Yeah.
We talked about whether we should go central because I said my left leg was starting to bother as well. And he says, I want to see if I could take care of it on the right if I concentrate it there. So that's
And
what
this
he chose
was,
to do.
what month are we in now?
Probably, if I have to guess,
May
June, July, somewhere around
20.
there. Yeah.
Okay.
So when that didn't work, we gave it a few more weeks, went back in, he wanted to see me again. We did telehealth. I convinced him that I didn't have to come down. We did back and forth, depending if he wanted to touch me. I said, is it going to help to touch me? I could tell you. And Diane's doing all the testing for strength. So
Yeah,
I said, I don't think there's any reason to come down. So
Right.
anyways, so after that, he goes, I think I have to send you to the neurologist. So he sent me to neurology. And at that time, my EMG was normal and my nerve conduction tests were normal. So that they decided that the neurologist, when he looked at it, said, I don't have any reason to think it's coming from your back. I'm concerned because all my large muscles in my legs were now hurting. I mean, when I do any type of palpation on my muscles, they really hurt, as well as my my tendons, attachments, and so on. So I said,
Both sides.
both sides now, right always more than left.
And there's no numbness or weakness with this. It's just muscular pain, diffuse muscular pain.
The only weakness is when I'm doing things, I feel weaker.
You feel like you're working
I have
too
to
hard.
work harder.
Yeah, like
they do feel weaker. I mean, when I do my exercises that I get ready for ski season, I can't hold my telemark stance as long as I want to. When I do my balance stuff, Diane always says, you're shaking more than you used to for a while. Because I start shaking. I almost feel like I'm getting muscle fasciculation at the same time, but I can't see it or feel it, but I feel a little bit of that. So the neurologist said, I think you need to go to a rheumatologist. So they sent me to a rheumatologist. He thought I had a rheumatologic problem. And I kept saying, this all started after my accident. I said, could it be somewhere else in my spine that we haven't looked at? Because it's also this breathing thing that we're not addressing. What else could it be? But he sent me to a rheumatologist. And of course, he did a bunch of tests. And the only test that came up positive was a very slight anti-2 muscle antibody, I believe it is.
Angiotensin 2.
Yes.
Yeah.
He said it's very slight, which could be, of course, as I know as well from an autoimmune test, it can mean nothing or it could be something.
Yeah.
And he said, okay, he goes, so we're going to pretend it's real and let's treat you as if you might have polymyositis or dermatomyositis, even though you have no skin issues. We're going to treat it as both. And then, of course, I went to my primary because they wanted to check my prostate, make sure that I didn't have cancer anywhere. We did chest x-rays because they also wanted to make sure that my lungs looked normal and I wasn't getting any of the secondary pulmonary changes because I was having breathing issues, so they wanted to see if they could see it. And there was no evidence of that, so they put me on pred at 60 milligrams daily for a couple weeks, and it actually improved my legs and my back felt better. I almost felt like my legs were back to themselves. Then they weaned me down to 40 milligrams, and about 2 days after going down to 40 milligrams, it recurred again. It started recurring again. And then when he got me down to 20, and he did a pretty fast wean, it was like I wasn't on anything. So at that time, I got into this was all at Dartmouth. At that time, I was still on the waiting list for the rheumatologist at University of Vermont because my wife actually goes to him, and I really like him. So I said, okay, I'm going to go for a second opinion.
Right.
Because I got in, so I said, I'm going.
Yeah.
So I went, and he said that he does it a little differently, and he does 60 mgs a lot longer. And he thinks I wean too soon.
Yeah.
Because if we're gonna rule out polymyositis, I have to do a longer. So I did a much longer pred at 60 milligrams, which helped me. But once again, and I can't remember how long it was, but it was quite some time on pred.
Meaning months?
At 60 milligrams, weeks.
Weeks, okay.
Weeks. And then when he weaned me down to 40, it started to come back again slowly. And then by the time I was halfway through 40, I call it, a message, and I go, I'm back to where I was. The only thing that worked was 60 milligrams. So he said, okay, then we're going to try methotrexate. I said, okay. So he put me on methotrexate because he said, well, 60 milligrams worked. Maybe, you just need something else. So we put me slowly onto methotrexate. And you're on no steroid now. You're just I'm weaning off the steroid, then I'm off the steroid. There was a little overlap, slight overlap.
Okay.
And then I'm only on methotrexate, and I'm as bad as I ever was, and I kept thinking I was getting a little worse. And then after that, methotrexate's up to normal, up the highest dose after another 6 weeks. He said, okay, we are going to have to go to injection. Maybe you're not able to take it in. You're not absorbing it through the gut, as some people don't. So I started giving myself sub-Q injections, which I did for about 6 weeks, and we upped the dose. And I got absolutely nothing but bruising on my belly. And no fun, because it stings.
Yeah, it stings.
I didn't realize it stings.
Yeah.
So anyway, so it didn't help.
Yeah.
So he said, I'm not convinced that you have a
it anyway,
rheumatologic issue. He goes, I'm going to send you back to a neurologist again. So I went to a different neurologist, because now I'm in the UVM
Now you're
system.
in the UVA system, yeah.
So I still have to wait a while, too long. But I finally get in. It's crazy how long you have to wait in between, because now it's already this year, months later, and I went through another ski season by now. And I skied. I just didn't have the endurance. I mean, I still skied.
Yeah.
I still did. I mean, I do backcountry skiing, so I skin up mountains and I skin. But instead of going twice up and down, I went up once and down in about the same amount of time, because I couldn't go as fast, because halfway up I'd have to take a breath. So in the meantime, I should say, when I was with the rheumatologist, he sent me for more workup, and they once again took chest x-rays, and he sent me for a stress test because I was having issues. And the stress test showed, quote unquote, I was normal, I passed, but I kept telling them that I shouldn't be this out of breath for what I'm doing.
Yeah.
I go, I understand I'm normal within the parameters,
Yeah.
but for my body, it's not right.
Yeah.
In the recovery time, she says, oh, it's normal. I go, yeah, but it takes me longer. I get tachypnic and I get tachycardic. I shouldn't do that at what I'm doing. So even though I knew that they were saying I was normal, I knew for me,
it wasn't
normal. Exactly. It wasn't my parameters. But I passed. And then they did, I believe, a CAT scan of my lungs, and I passed that. And then they did, and I get confused whether we do MRIs or CAT scans, so forgive me, I might be. Then they did, I think, a CAT scan on my leg, because he wanted to do my thigh, and there was no sign of myositis, because he was hoping that there would be a sign of myositis so they would know where to biopsy if we had to biopsy. But there was not. So he sent me to the neurologist again, and the neurologist did a gazillion new tests that I have not had before, looking for genetic stuff and all sorts of things. And he repeated the immune panel, and again, the only slight one was the same enzyme. So we thought it might be real. It still might not be real. No one's convinced that that's what it is. So that's when he said, okay, it's time for a muscle biopsy. But again, that was going to take so long. And in the meantime, I'm running my own case here, right? So I got into the back specialist who did my neck again, because I wanted my lower back evaluated, because the neurologist said, I still think it's your back. I said, oh, so we're full circle now. So I went back to the back specialist, and she looked at it, and they said, I think you should inject L3-4 or L4, L5 instead and see what we get. So she injected L4, L5 centrally this time, and I got a little bit of local relief for 48 to 72 hours, but no relief on my legs. And then the discomfort in my lower back, which again is chronically low grade. Some days it's worse, some days it's not as bad. Came back. So her plan was if that didn't work and my muscle biopsy doesn't show anything, maybe we should do L3, L4 and see if that helps. One person in all this who I saw, said maybe we should also CAT scan we should MRI your thoracic area to see if we have any changes there, which have not. It's the only place that hasn't been done. Or they're talking about maybe even reevaluate doing the whole thing again. So that's where I am right now. I just got the muscle biopsy. I think you should have gotten that. Because I emailed it to Judy, and she said, and the neurologist was going to talk to me when they came back. So I messaged him as soon as I got it. I go, I just got it. You want to please give me a call? I want to know what's going on. And I got a message from his nurse. He says it's normal, making a follow-up appointment if you want to see him.
So they don't feel like they have anything else to offer?
I don't know. I don't know what he's going to say, because he didn't message me back. It was follow-up appointment.
Yeah,
I go, I don't want a follow-up appointment with him. It's like,
I
just want to know what he wants me to do, because we're at this point where I've done this long enough, and he had a great conversation. I would just wish he would just get on the phone and tell me, this is
You're
what
a
you
year
should.
and a half into this now.
I'm
And-
over a year and a half into this.
Yeah.
And I'm very frustrated.
Yeah, I imagine.
And
so
my blood pressure's gone up a little bit through this. I've always had normal blood pressure. Now it's a tinge high, and it's not consistent, just like my muscle pain isn't consistent. Some mornings I wake up and I go, oh, I feel good this morning. And I'll take a walk, and on the flats it feels great, and then I start going up a hill, and I'm going, oh shit, it's right back, excuse me. It's right back to where I was.
Yeah. What hurts now?
Today,
Yeah.
I definitely have some neck. The injection in my neck did not really help very much.
Not super helpful, yeah.
It's, when I go here, that's as far as I want to go, and I feel it here. I can go here, and the right side is affected now. My lower back, especially by my L4, L5, L5, S1, all the way, that whole area is sore. And my legs, again, are sore, but it's not consistent in where they're sore. Some mornings I'll feel pain in my right buttocks going down into my hamstrings.
That hamstring thing. Can I see you walk?
Sure.
Just walk over to that wall if you would. And can you go up on your tiptoes?
Oh yeah.
Go ahead, walk back toward me. You can turn around and go, but walk up on your tiptoes.
Okay, want me to take my shoes off?
Yeah.
Okay. It'd be much easier for me.
I see you're adapting to Arizona quickly, Mr. Vermont, with your flip-flops.
Well, as soon as I can get out of regular shoes, I do.
Do you mind doing it the other way? I just can't quite see your heels from here. Yeah.
That's why I wear these loose pants.
That's nice. Yeah, as high as, like ballerina high as you can get on those toes. Okay. Okay. And you can walk that way, but walk on your heels with your toes up in the air.
Okay, now just so you know, when I do that, my calves hurt more than
When you do this or when you went up on your toes?
when I went on my toes.
Your calves hurt?
Yeah.
Yeah. Okay. Have a seat right here, and you can sit down, drape your feet, bum here, feet there.
Okay.
So just sort of drape your feet over the edge, yeah. And straighten your knee. Oh, sorry.
I'm sorry.
There you go. Straighten your knee out. Hold it. Straighten this one. Hold it. Lift your knee up toward the roof. Yeah, hold it. Knee to the roof. Hold it. Good. Do you feel me the same here as here?
Mm-hmm.
And here as here?
Yes.
And here as here?
Yes.
And here as here?
Yes.
Just tap your reflex. Does it hurt?
It's tender.
Everywhere?
Yep.
Is there? Can you stand up and show me your back?
Sure.
And point to where your back hurts the most. There.
Today?
Yeah.
It
Right in there?
hurts.
Okay.
Right
gotcha.
there. Right around that area.
You're tender here.
No. Nope. A little tender on that, right? You're tender there.
How about here?
A little bit, but not as much as the right.
Here?
No, not today.
Here.
Yeah, tender.
Okay. Can you sit back down again in that weird position and bring your left foot up and cross,
How high up?
like cross it over your knee.
Okay.
Yeah. And then just relax. Does that hurt?
No.
Go the other way. And let it relax. Does that hurt?
No.
Okay. All right, you can have a seat. Let's take a look at the scans we've got. And it's going to take, you can put your shoes back on if you like. Let me just get the
That's pretty
images up.
comfortable. It's comfortable being barefoot.
Yeah, maybe you should live in Arizona. So here's your MRI.
Yep.
Can you see there?
Yes, I can.
Yeah. And you see my cursor here?
Yes, I can.
So here, this would be your back and going up to your head and down to your bum.
Okay.
And these squares are the vertebrae.
Yep.
So that looks great. These vertical plates are the discs.
Yep.
So your spinal canal, first of all, you've got a totally normal curvature, which is good. All the vertebrae appear to be in the right place. You've got a little wear and tear on the discs, but nothing, it's very appropriate for age, and all good. There's a perfect disc ends flush with the back of the bone, just like that. And so this one is not quite perfect. This one's bulging a bit. But I mean, there's nothing, this is entirely age appropriate. Tiny, tiny bulges here. This might look like it subluxes and is a little bit narrow here, but not tremendously.
Which number were you at?
This is number 5.
5, okay.
And this is number 4. If we look, let's talk about narrowing. The way to look at that is on the perpendicular. So this green line is the plane that we're cutting in over here. And see those little speck dots?
Yep.
Those are your nerve roots. They look here like they're dots. They're not. They're strands. But it's like if you took a spaghetti and held it on end, it would look like dots. Yep. These are the dots. So it's sectioning.
Yep.
So as this looks great. So you can see each dot has plenty of fluid around it. Everything's nice. Here, instead of that nice open round, we're getting triangular.
Yes.
That is mild spinal stenosis, and that's your 3-4. Here's your 4-5, and now we're really triangular, and we're kind of pinching as we go out to the side. That's called lateral recess and foraminal stenosis.
Okay.
And then that's at your L4-5, and then as we go down to your 5-1, the one that's most often the problem, and yours is fantastic. Okay. So I wish you would have done at your 5-1 what you did at the others. But so a little bit of stenosis, but nothing terrible. That is the MRI from July 21st of 2020. Yes. So this is when you came, this is the first MRI of your low back when you came back and were having the back pain when COVID started to ease up a little bit.
Yes.
Now
that's after he addressed my neck. He said, let's now address your lower back, which is what I really wanted.
Yes. This is your neck, and these are some oblique MRI sequences of the neck. Not super helpful here. I'm not sure. They're probably going to be in conjunction with other. This is your chest, I think, with the heart issues. I'm not really an expert on this, but I don't see any, even my kind of uneducated view, I don't see anything.
My uneducated veterinary view agrees with yours.
Is the same. Probably
I know what lungs look like. Lungs.
Lungs look like
no
lungs.
matter what species.
There you go. There you go. So here we're looking. Here's your neck in a neutral position that looks pretty good. It's basically the same thing. Little arthritis at the bottom. This is what causes those, the need for those annual epidural injections. Here's the x-rays from when they did the injections in your low back. Here's the needle coming in. And here, looks like they've injected contrast. This is outlining a facet joint. So they've injected the joint here directly. And there's more of that. Here they're showing the location. Almost looks like they did an interspinous ligament injection, or maybe they were just localizing the facet. This is more of this. This is they're injecting your neck. This is the facet joint injection in your neck. Or maybe it's the epidural in the neck. Not sure.
When was that done?
This is July 16th, 2020.
Yeah, that was epidural.
That was epidural.
Yeah.
Here's all the CT scans of the chest, which I don't know, seem fine to me, but take it for what it's worth.
Yeah.
So basically, we've got a little bit of stenosis on the MRI of the lumbar. We've got some degenerative. I saw other MRI of your neck. I'm not sure. Oh, here it is. Yeah, so here's the MRI of your neck. By the way, we just get some passing images of the brain which look totally normal at its base. So that's encouraging and reassuring. Here's the spinal cord coming down, and then a little tiny bit of stenosis there, tiny there, little bulging disc here, but nothing terrible. You do have one disc herniation here, there, on the left, at your 2, 3, 4, 5, 6, 7, at your 6, 7. Usually that would be these fingers, but for some reason in you, I think it was this.
Yeah.
But that's disc herniation, usually transient. Certainly not something that surgery should be necessary for. Usually these will resolve by themselves.
Okay.
When I hear your history, first of all, before we go, any questions about these images?
No, I've seen them before, and I appreciate you walking through
It's
them with
helpful.
me because I wish someone else would have done that with me before as well. I mean, I look at them, and I've looked at MRIs of animals, so I have an idea what's right and what's
much harder,
not.
isn't it? Because you don't know what's normal.
Well, yeah, but so I put it with the report, so I could read it and put it with the report at the same time, so I could at least understand it. But yes, I appreciate that. Thank you.
Well, thorough workup. I think all the care you've had is excellent and appropriate and escalating. I feel like when I hear your history and I sit and listen to this and look at these films, I feel like I'm seeing someone with an undiagnosed neuromuscular disorder, and they're very common. There's hundreds of them. They feel exactly like what you have, whether it's myasthenia gravis or some weird form of, some mutation form of a neuromuscular enzyme. It's very common. Thank God it doesn't seem to be ALS, because we're 2 years into this. You have no upper motor neuron signs, and it doesn't seem to be progressing. But when I was really getting a little anxious, to be honest, when you were telling me about the pulmonary symptoms, and I was just hoping you weren't going to get into any wrist drop.
Right.
Or tongue fasciculation or any of these other things which you should watch out for. But hopefully that's not in any way, doesn't seem to be what we're dealing with.
Right. Well, there's one other thing I was going to ask you to check. The only thing that changed, well, there was one thing on my EMG. I don't know if you noticed the second one that he did. He noticed some slight change.
Yeah.
I can't remember which one it was.
Yeah, but EMG is a very insensitive test.
Okay.
And to be as normal and high functioning as you are, it would be very unusual for EMG to find something other than an ALS or a neuromuscular, which is going to be very, very tricky to pick up in a routine EMG. Okay.
And lastly, the only change on my reflexes, the last time they did it, I don't know why, I had hyperreflexia here, just a little bit. And
it's normal.
And I wasn't worried. I did it at home, and I said, that's not too much.
That's weird.
I wasn't that worried about it. Yeah. Got my hammer, and I go, that's not too bad. I said, Diane, what do you think?
Yeah.
So anyway.
I think, I really feel like you have a neuromuscular issue that hasn't been diagnosed.
Okay.
And the worst thing that happened was the rheumatology referral, because it just takes you down a rabbit hole of many, many, many disorders which are very unlikely to be occurring in you, which could be diagnosed if they became worse and really shouldn't be worked up at this point. Okay. So I think you likely have a neuromuscular disorder. Okay. It may or may not be intermittent versus progressive. If it's progressive, it will become diagnosable soon. If it's not progressive, who cares? Because it should recede and leave you alone and go away. And so my recommendation to you, your spine is not your issue. You certainly do not need surgery of any kind. The stenosis that you have does not explain the symptoms that you're having and doesn't warrant further intervention. I would not have any more spinal injections other than the neck for the herniated disc and the pain that can cause there. But I think it's very unlikely that anyone's going to help you with injections in your low back. And there is no injection which can help the symptoms that you're having in your legs, which are your primary symptoms. Okay. So I think if I were you, I would find a good neuromuscular neurologist and see them once a year and hope they never figure out what's wrong with me, because that would mean it got worse.
Okay.
But there's no immediate anything that can be done with this.
I was afraid you were going to tell me that.
Yeah, but
because that doesn't help the depression. But I
separate problem, right? It's a reaction to.
Oh, I know.
To a screwball situation.
Oh, I know.
But there's nothing. You got to let it go.
Got to work it through.
Yeah.
And I'm on Lyrica I was on gabapentin, and it didn't do a whole lot, so they changed me to Lyrica, and we've upped my dose, and we're playing around with that to see if it helps my neck pain and a little bit. And
are you sleeping?
I'm sleeping.
Too much? Not enough?
Probably. It depends. Diane thinks I snore more now. She's worried about sleep apnea since I've been my upper dose of my Lyrica, but I'm not quite sure.
Lyrica is a dirty drug.
It is.
Oh yeah, it's a dirty drug, and I mean, the only way, if I were you, the only way I would even think about staying on Lyrica, Neurontin, okay, you try it. If it works, great. If it doesn't, you can go off it, go on it. You know, Lyrica is a dirty, dirty drug, which is so side effect laden and has so many issues that I would tell you if it wasn't helping me enormously, I would definitely talk to my doctor and then stop it, and or taper, whatever they want you to do. But I would get off it and see how you feel. I mean, the nurses always call it loopy Lyrica.
Oh, okay.
Lyrica
it made me loopy when I went up to 75 mgs from 50
for sure.
Mgs. Diane said, you're not remembering things like you normally do. I am. Well, I said, I'm in a fog. And she goes, people on Lyrica always do that when they people up their dose marks, because she deals with it. But they
also, Lyrica also almost disables your ability to deal with your own emotional state. I mean, it's a disaster. Lyrica is, it's like a machine. It's very helpful when you need to really do something, but it's not doing that for you.
Can you just stop it, or do you have to?
How much are you on now?
75 mgs twice a day.
Well,
yeah. They just changed it to 50 mgs. TID, because I told her 75 mgs twice a day wasn't doing it. So she said, let's try splitting it into TID and see if you get better.
You should never stop a drug without talking to the doctor who prescribed it.
I know. I'm just asking your opinion.
If it were me, I would stop it.
Okay.
So,
and gabapentin long term, if it helped me?
Definitely not.
Okay.
It's gabapentin's a little vitamin-y.
Okay.
Like, if it helps, okay. It's kind of it's not that side effect laden, and it's much less intense than the Lyrica. Okay. But these are psychoactive drugs, and who knows what they do to you long term.
Okay.
I think the other thing is, when you're taking medications like this, it becomes much harder to use your own resources to recover. And you are a very functional guy. You have a lot of resources. It's like when you were saying, this is not abnormal to you, but it's abnormal to me.
Right.
Like, you don't need these meds.
Okay.
You can recover.
Okay.
And so I would encourage you to get off everything.
Okay.
Deal with the way you feel, and see what happens. This is a waiting game, and it's frustrating, but sometimes when you pursue an outcome, you actually create negative outcomes that could be avoided if you just relaxed and wait and saw which way it headed. There are many. I used to do, before they got, how did they do your nerve muscle biopsy?
My muscle biopsy they just did?
Yeah.
I was going to have you look at the incision to see if you think.
Let me see.
I did it. I'm taking my pants off.
That's all right.
I don't care. Just don't let.
We won't put it on you. He's got underwear on.
Yeah, today. So this was done a week ago Thursday.
Yeah, let me see.
So this is 8 days.
Yeah.
So he told me he was going to take 3.
And it's perfect.
Can I go in the hot tub tomorrow?
Yeah, totally.
Okay. Yeah, that's the main question.
I think you might belong in Arizona even more than I thought.
Oh, I go in the hot tub in the winter and at home. No, that's not true.
No, you're fine.
Yeah, I told Judy I was going to ask, because she said, "You go in the hot tub? Can you go yet?" I go, "Well, it's going to be 9 days." He told me 10, and I'll ask.
You're fine.
I'll ask a surgeon.
Yeah,
this surgeon says it's good.
It's healed. It's healed.
So, anyways, that's what they did, and he told me he was going to take 3 strands, and
they did. So they got a good amount of it, and it looks normal.
Yeah. So, could you tell me just quickly, because what is is that a normal percentage for type 1, type 2? Because I am not familiar with that at all. Those.
I don't know. I have no idea.
Okay, I didn't know if you knew, because I looked it up and I couldn't figure it out. It looked like type 1 was supposed to be a little bit higher in men, and I said, why is that really? But that's normal. That was my message.
Not only do I not know, the guy who described type 1 and type 2 worked in the lab next to me at the NIH. Literally the guy who discovered it. And I still don't know. Okay. Which is even worse. But I don't think it's, in the interpretation they say mild myofiber variability, see comment. The finding of the myofiber is largely nonspecific. No significant evidence of myopathy is present. Right. So I feel confident that there's no explanation there.
So did I.
Yeah.
It looked like one of those things I go, they see something, but they're not sure, and it's not much.
Yeah. I mean, I think the thing to do here is withdraw energy from the entire problem until it either, it's the one variable that often helps us in this situation is time.
Okay.
But it's the one you can't control. You know, let it play out.
Okay.
And so many. I used to do these muscle biopsies before they get, now they can often do them through a needle.
Yeah.
But I used to do these, and every patient described this long and arduous and painful journey toward diagnosis.
Yeah.
And it's just one of those things that you're either on that path or you're not, but it doesn't have to be painful. Sometimes you just need to stop and let it go. You cannot diagnose these things until they reach a point of prevalence that it's diagnosable. And so it's not killing you. You just got to learn to live with it until you either find out what it is or it goes away, which is what usually happens.
Okay.
And so, you know, hopefully that'll be you.
Okay. I do go to an acupuncturist just because I believe in alternative medicines.
I'm not even sure you can call that alternative anymore.
I don't. I don't.
Yeah.
I mean, I used to do acupuncture on dogs. So
yeah. Okay. So you know.
So
yeah. No. It's really.
I mean, I think it's real. So it's.
Oh, it's certainly real.
Yeah.
I don't think there's any question about that.
Yeah.
How it works, you could argue.
Yeah. Right.
But
right.
But you know, yeah, I think acupuncture is a really good idea. I think finding ways to cope with it, which could be the right kind of exercise. Yeah. I think in your case, it's also allowing yourself, maybe you do one run now. It's okay until you figure it out. You know, none of us are getting any younger. And
just have to tell this.
Yeah. Well, there's something going on, and the expectations are such that maybe you just say, hey, you know, it is what it is. We're in this gray zone, and we're waiting to figure this thing out, and we're just not going to choose not to react to that and see what happens. And the best thing that could happen would be you never find out.
Yep.
The worst thing that could happen would be you do, and then you'll deal with it. You know, 99% of these things have no treatment. So what's the, you know, you can't spend your life pursuing a diagnosis that is not actually worth knowing in terms of treatment, and then you spent all your time pursuing that diagnosis. I love acupuncture a lot more than Lyrica, I'll tell you that.
Okay.
I never saw anybody get loopy on acupuncture and have side effects and become homicidal. You know, homicide, for your poor wife. Homicidal ideation is a side effect. Okay. So I'd get off of all the, don't pursue the steroid. I mean, that was crazy. Yeah. You know how many side effects your body went through?
Oh, I know. I know. My bone density test wasn't good. I was really upset because I'm on you know, calcium now with vitamin D because I was not normal for a man my age, and that was not good. I was not happy. Yeah. As much as I exercised, it was crazy.
Right. Exactly. Exactly. But you, I mean, to me that is not the right path. You know, very, very high complication, side effect, dose related, high dose for really if you had dermatomyositis or polymyositis, it would have gotten worse. You could have then really seen the enzymes pick up. Then it would have been appropriate. But like, to me, that was way too aggressive. Okay. And not helpful, and take a year to get that crap out of your body. You know, everything that the hormonal, the diurnal cycle, everything is altered by these kind of these high steroid pulses. And I just feel like the right doctor for you is certainly a neuromuscular neurologist. Okay. I don't know how often you get out here. You look like you belong out here, by the way. I keep telling you. But we do have obscenely good neuromuscular neurologists here. Okay. And if you're coming out here once a year, if I were you, I would go see a neuromuscular neurology specialist here and not worry about it the rest of the year. Okay. Okay. But you definitely do not have any surgery on your spine.
Okay.
I would not have any more injections.
Okay, I'll take your advice.
That your facet joint was injected with contrast, that destroys the facet joint.
Okay.
If
That's
you
how
did,
they've always done my neck. They always put contrast in first.
never inside the joint.
Oh, not in joint. Okay.
Yeah, no, they put contrast to make sure they were in the right
Right,
place.
right.
But your entire facet joint.
Oh,
was
they went in the joint. Okay.
You had
I
an
see.
arthrogram in a facet joint. That's contraindicated.
Oh,
It destroys the facet joint, and then your back hurts.
Oh, great. Okay.
Yeah, so you're
Gotcha.
kind of like chasing your tail on these. These treatments are harmful.
Okay. Gotcha.
So stop helping. You know.
Okay.
Stop helping me with your megadose steroids and your facet arthrograms, and just stop helping, and
Back
you'll
up.
probably be better off, if not okay.
Okay.
So yeah.
Okay.
So that's what I would recommend.
Okay.
All right.
Okay. Wow. Okay. Lots of
Well, I
thinking.
wish I had a more definitive answer for you, but
Yeah. Well, between you and me, I didn't think we would because
Yeah.
the problem is I know too much and know too little, right? Isn't that what they say?
yeah, yeah. There's definitely.
But at least there's some medical knowledge there, and it's not Dr. Google.
yeah, yeah. No, but that's absolutely a phenomenon, right? And
Right.
I think it's very often doctors are driven toward bad care, and I mean, in all honesty, that's what's happening to you.
Okay.
So stop doing it.
Gotcha.
Stop
I'll take your opinion. That's why I wanted to see you.
Yeah.
When Judy said I could see you, I said that's exactly what I was hoping.
Yeah,
I've been itching her. I'm coming out.
Yeah. Well, let me know if you want to. If you do want to see somebody out here, there's a couple of guys who I just think would be literally the perfect. It's not like they don't have good doctors at the University of Vermont or in Dartmouth. They do, but you do need a subspecialist of a specific type. You need to see the neuromuscular person in
Okay.
the neurology department.
Okay.
And doctors, they're individuals. When there's only one for a region, which usually this is what the case with these guys, you often, what if they're not the one for you?
I understand.
So I don't know.
I understand.
Consider seeing, if you haven't seen a neuromuscular neurologist, consider seeing one.
Okay.
And if you have, then I would recommend you pick it up here and come see your sister once a year.
That's a little harder, but yes.
You could do it. You're going to wear those flip-flops in Vermont? I guess in the
All the
summer?
time I wear these flip-flops.
Is that right?
No, not all the time.
Not
but,
all the time.
But when spring comes and it's that first beautiful day, you walk outside, you go, oh, I can put my flip-flops on today. It's 60 degrees and it's lovely in the sun.
Yeah. Yeah, it's a
we
beautiful
do have
state.
nice weather occasionally.
Oh, yeah. Yeah.
And we have
Well,
great
you do
snow.
have great
And we have
skiing.
great snow. So
By
I
the way,
love
there's
it.
nothing in your spine, your neck, or your low back that's going to be hurt by skiing.
Okay. Good.
So it is a comfort issue, and you're obviously neuromuscularly weaker than you were, so you're prone to injury. So think about that.
Yes.
You know how everybody gets hurt on the last run of the day?
Oh, I know.
Just quit before the last run.
That's when I hurt my knee. I know.
Right. Just go.
Been there, done that.
Just take one run less than the one you're going to get hurt on.
Yes. I've gotten to that. I've gotten that point mentally.
Yeah. Yeah.
That happened once, and I said I knew I shouldn't have done that last run.
It was that last run. Yeah.
It's always the last run.
It's always the last run, one way or another.
Yeah, well, somebody says, well, Marv, it's going to be the last run anyways if you get hurt. I go, no. It's before you go down that you go, I'm done after this run.
Yeah.
My legs can't do anymore.
All right, Marv.
Oh, man,
good
this
to
was
meet
great.
you.
This was great.
Yeah,
Thank you
great to
so
see you.
much. You were so
Yeah.
helpful. I really
Well,
appreciate your time.
if you think of questions in the future, don't hesitate to call me.
Oh, thank you.
I'm here.
Thank you so much.
Yeah.